my name is Bianca. Can I get your name and date of birth?
My name is Macy. I was born March 31st, 2005.
Alright, hi Macy, my name is Bianca. I'm your nurse today. And I heard you were recently diagnosed with type 1 diabetes. Yeah, so did they talk to you about that? Like what it means?
Not really.
No? Okay, so as a little overview, type 1 diabetes is where your body has attacked its own pancreatic cells, and those cells create insulin. And think of insulin as like a key for the cells in the rest of your body that open them up to allow glucose or sugar into them to use for energy. And so without insulin, you don't have that key and the sugar can't get into the cells and it stays into the bloodstream, which then can cause many other issues such as vessel damage, nerve damage, or eye damage. Does that kind of make sense? Today, I'm going to be kind of telling you about administration of insulin and some tips to manage the diabetes, all right? I see your provider has ordered 2 different types of insulins. Do you know what those are at all? No? Okay, so the first type of insulin that he's ordered is a long-acting insulin called insulin glargine. And what this does is it creates a continuous basal rate for blood sugars throughout the entire day. So the onset is about 3 to 6 hours and its effects last for about 24 hours. So it's important that you only administer it once a day and you want to administer it at the same time. Does that kind of make sense? Mm-hmm. The second type of insulin that your provider has ordered is a rapid-acting insulin called insulin lispro. And this is used to counteract the blood sugar spike that can happen after eating a meal. So it's important that you take this within 15 minutes of eating or immediately afterwards. The onset of this is about 15 to 30 minutes and the effects last about 2 to 3 hours. The dosing for these insulins is dependent person to person and situation to situation. So your provider will give you specific instructions. Now, did your providers show you how to check your blood sugar? Now, coming back to insulin, the storage for insulin is very important. So you want to make sure that your insulin stays refrigerated, okay? Once you open a vial, it can stay unrefrigerated for up to 28 days, all right? But after that 28 days, you want to make sure you throw it out. So it's important that you write down the day that you opened it. Additionally, you want to look at the solution, make sure that it's clear. If it's cloudy or anything's floating in it, you want to make sure you get rid of it. Lastly, you also want to check the expiration date and make sure it's not expired. If it is, it won't work and you shouldn't use it. Now we're going to talk about the injection sites, okay? So, kind of demonstrate on myself here, you can use the back of your arm, you can use your abdomen, and you can also use the top of your thigh. And what's really important is you want to rotate your sites every time you inject your insulin, and that's just to prevent breakdown of the subcutaneous layer. All right, now that we found the injection site, you want to make sure you have all of your materials. You have your insulin vial. Again, you already checked the solution, checked the expiration date, made sure that it was not unrefrigerated for more than 28 days. You have 2 alcohol prep pads. You have your insulin needle. And again, you want to make sure that it says units, not milliliters. And usually, insulin syringes are orange. And you want to have a little cotton pad. So what we're going to do first is we are going to prepare and draw up our insulin. So you want to take one of your prep pads and clean off the top of your vial for about 5 to 10 seconds. Right, while that's drying, you're going to take this top part off so you can use the plunger, and you're going to pull back however much insulin you need. So for right now, we're just going to use 10. And you want to make sure that the top of the plunger is right in line with the number you need. Okay, then you're going to take this top off. Now the needle is out, so be careful. You're going to put it into the vial. You're going to push the air in. You're going to flip the vial upside down. And it can be helpful to hold it like this. And you want to be able to see your numbers. And while you're pulling this back, you kind of want to go pull back, pull in, pull back, pull in. And you want to go past the actual amount you need. This just helps get rid of bubbles. Okay, and then push it back in right to that 10 mark. And if there's any bubbles, you can kind of just flick your syringe
on the side to get rid of those bubbles. And double checking our measurement. And then you're going to pull this out. And it's very important that you do not recap your needles like this, because you'll likely poke yourself. So if you need to recap your needle, use the scoop method. You're going to scoop up the cap, just like that, and then push it down on the sides. All right. Now we are going to prep our injection site. So you're going to take your pep pad, and you're going to clean the site in a circular motion for about 10 to 15 seconds. You're going to let it dry. You want to make sure that you don't blow on it or kind of wave your arm. That just creates more bacteria in that area. Once it has dried, what you're going to do is you're going to pinch the skin up, and then you are going to take the needle and put it in at a 90-degree angle with a little bit of force. So I have my needle here. I'm going to take the cap off, pinch my skin up, and go in at 90 degrees. And then you're going to slowly administer the insulin. Once all of the insulin has been administered, you're going to take the needle out. And some needles and syringes have safeties which cover the needle. Since this one doesn't, you're going to immediately put it into the sharps container. If you have any bleeding, you can just take a little cotton ball or Band-Aid and just put it over the injection site till it stops bleeding.
Once your sharp container gets filled, you can see the full line here. You want to make sure that you don't just put this in the normal garbage. Usually pharmacies or doctors' offices will allow drop off of these. All right, another really important thing about insulin is it can cause hypoglycemia. And so it's very important that you eat when you take your insulin, because if your blood sugar goes too low, usually below 70, that can cause dizziness, shakiness, it can cause a loss of consciousness, and even death. So it's very important that you get your sugars. If you start to notice those symptoms and you're conscious, you'll want to take some simple sugars, such as candy, fruit juice, or glucose tablets, and recheck your blood sugar about 10 to 15 minutes later. Once it's gone above 70, then you'll want to take something with more complex carbohydrates, and then also a little bit of protein, such as crackers and peanut butter, or yogurt and granola. Now, if you go unconscious and someone else is around, they will need to call 911. You should also carry around a glucose nasal spray. They can just basically insert it into your nose and spray it, and that'll help you get your sugars up. It's very important that they don't try to feed you anything or give you anything to drink while you're unconscious, because that can cause aspiration.
Well, what do I do if my sugar is too high?
Yeah, okay, so if your sugar is too high, you'll want to take some insulin. But if your sugar is continuously high, you can go into diabetic ketoacidosis, and with that, your organs can start to shut down, which is not good, and you want to make sure that you seek medical attention. Some symptoms of this is increased thirst or increased urination and confusion. Outside of checking your glucose levels frequently and administering insulin appropriately, there are some lifestyle choices that you can make that can help managing your diabetes easier. This includes having a healthy, well-balanced diet, having exercise every day, maintaining a healthy weight, and no smoking, okay? I can always send you a reference to a dietitian if you need help with creating a diet, and you should always check in with your provider about every 3 to 6 months. They'll usually do an A1C, check your cholesterol, and blood pressure.
What's A1C?
Oh yeah, A1C is just a blood test that looks at your overall blood sugar levels over the past 3 months. All right, Macy, I know this is a lot of information, so do you have any questions?
Yeah, when will my diabetes go away?
So unfortunately, diabetes is a lifelong disorder. So you'll have to manage it for the rest of your life. But again, taking your insulin and making those lifestyle changes can help prevent complications. Any other questions?
No.
No? Okay. Without any further questions, I just want to make sure that you understand it. So would you mind demonstrating giving your first insulin shot on yourself?
No, I don't mind. Sounds good.
Okay.